I will tell you the most important thing is the semen examination, which is very easy to find out, and it is very no one can have inhibitions. Nowadays, a lot of men are having inhibitions to come and get themselves tested. So it's a very simple examination to get themselves tested, and it could give us a lot of information which could be easily corrected.
Doctors of All India Institute of Medical Sciences have reported that over 12 to 18 million couples in India are diagnosed with infertility every year. They have reported that while the sperm count of a normal Indian adult male used to be 60 million per milliliter 3 decades ago, it now stands at around 20 million per milliliter. With such alarming number, it's better we all are aware of the know-how for male infertility and take adequate precautionary measure for the same. Thus, today's expert doctor is Dr. Rukkayal Fathima, who finished her MS Obstetrics and Gynaecology from the Institute of Obstetrics and Gynaecology, Madras Medical College, Chennai. She has completed the MRCOG from the prestigious Royal College of Obstetrics and Gynaecology. She has over 8 years of experience practicing medicine in various hospitals and clinics, and currently is the director of the Hive Fertility Clinic and Women's Center, which caters to all fertility management. Doctors' Day is a reminder to all of us to take some time out to appreciate the doctors who put all their lives into offering services to others. So Dr. Rukkayal, happy Doctors' Day, and it's such a great pleasure to have you today on DoctorsStory. Thank you so much for joining.
Thank you so much for giving me the opportunity to meet you today on this special occasion. Thank you.
So doctor, let's start with the symptoms of infertility that one can notice or feel on their own, and if so, when should they seek help for infertility?
For a male, when they have fertility issues, when they should meet a doctor. So mainly, whenever they are going to, it starts from their simple problems as such. So once they get married or they want to get conceived, and when they are trying for pregnancy, if they are not successful even after trying positively for 1 year without any unprotected sexual intercourse, and even after that, if they don't get conceived, in that case, they should consult a doctor for fertility issues. Otherwise, in case of males, there are a lot of problems when they should get consulted. So whenever they have a difficulty in erection problems, whenever they have a difficulty in the ejaculation, when the intercourse is not quite normal, when it is not sufficient erection for a long time, and all these issues, they have to consult a doctor. Otherwise, males who have been trying for conception and who have other issues such as medical disorders such as thyroid or diabetes or hypertension, all these problems, obesity, and they also need to consult a doctor to find out whether there are semen parameters and other parameters or not.
Could you elaborate more on the diagnostic? How does male infertility get diagnosed later?
Diagnosed, yeah. So whenever they come to us, we start basically from the history. So it starts right from their age. So whenever, not only for women, even for men, beyond an age of 40 plus, their semen parameters do drop down a little. There is a difficulty in the motility as well as the morphology. Then comes the occupation. So those who work with heavy agriculture work, or for a long time they are in the chemical industries, they work for a very long time, stand for a very, very long time, and those who are exposed to heat for a long time, and those who are at gym, training for a long time, and they are taking some additives to bodybuilding. These are the people who are more prone for fertility issues. So it starts right from the occupation. The next one, we ask them about their medical disorders. As I told you earlier, any kind of thyroid or diabetes, hypertension, coexisting with them will definitely have a problem. Then any kind of surgeries in the past, for example, in their childhood, they would have had some kind of hernia surgery. They seem to be simple, but then could be associated with their long-term fertility issues. So otherwise, any kind of medical issues in the past, something like mumps, in their childhood, whenever they are affected with some kind of viral infection, that will have a testicular impact later, and that will reduce their sperm parameters to an extent. And as such, family disorders, whenever there is a family history of hypertension, diabetes, and other siblings in the family who have a problem with getting conceived, they also do get associated with fertility issues. So right from the medical history, we start questioning the patient to diagnose it. Then there comes the most important parameter called as the semen examination. So a simple diagnostic tool to find out about the fertility issue is the semen examination. So how it is done? Usually we ask them to come to the lab and give the semen sample, usually given after a 3-day of abstinence. And we examine 3 important parameters. One is the count, another one is the motility of the sperms, another one is the morphology. So WHO has established some standards to find out about the exact count, motility and morphology. Beyond a certain limit, that is between, when it is lesser than the normal level, then they end up in some fertility issues. So this is the most important diagnostic criteria. Once the semen examination is done and once we found out some problem is there, then we subject them to a higher test. The higher test might include the hormone analysis of the male, which will include some basic hormone testing such as the FSH, LH secreted from the brain, and it will include the other hormone which could impact the testicular development. The next one is the ultrasound examination to find out how the testis volume is, how the blood supply of the testis is, so whether any parameters of these are affecting the testis problem and sperm production as such. And then when the male has some problems such as azoospermia, that is the count is extremely low or no count at all, in those situations we also subject them to a genetic testing called karyotyping, where we will want to know the chromosome pattern of the male also. So these are the basic tests. Of these, I will tell you the most important thing is the semen examination, which is very easy to find out, and it is very no one can have inhibitions. Nowadays a lot of men are having inhibitions to come and get themselves tested. So it's a very simple examination to get themselves tested, and it could give us a lot of information which could be easily corrected.
So doctor, coming to the treatment options, what are those options available for male infertility, and can you just take us briefly through the treatment processes?
So again, it depends upon what kind of problem the male really has. Okay, so usually whenever we test the semen sample and if we feel everything is normal, still they are not getting conceived, we first tell them to do some lifestyle modification. What does it really means is just to stay calm and have a stress-free lifestyle, eating on time, sleeping on time, having proper diet at proper time intervals, and all those things will definitely have a good impact and increase their fertility potency. Then coming to if they are having problems, we analyze what cause of problems. If the count as such is low, we try to find out where the problem is. There are 3 types of causes exactly for the male fertility. One, when the hormones from the brain are not getting secreted adequately, then the sperm production is affected. Second thing, the testis as such does not function properly, so the sperm production is affected. The third case, when everything is normal, there is something called as the obstruction, where the sperm ejaculation alone is the problem. So whenever we evaluate a male, we try to differentiate these 3 causes, and then we go about treating them. So in cases of simple cases like when the brain hormone problems are more, we just tend to give them some tablets as well as some injections which will increase the production of the hormones, and as such it will promote the testicular sperm production. The second thing is in cases of patients who have an obstruction problem, everything is normal and just the sperm ejaculation is the problem, then we subject them to some scan, find out some level of obstruction, and then give them some option of surgeries. And if they are not willing, there is a wonderful method called TISA, testicular sperm aspiration, where we put them into light sedation and we aspirate these sperms, and using the sperm we can go ahead and do IVF, and in case they can get easily conceived. The second one. Third problem is case of if the testis as such is spoiled, we try to find out whether the problem is mild or severe. Mild problem as such, the count is okay, but the motility and morphology are abnormal. In that case, we just give them antioxidants and lifestyle modification. In some cases where the testis production is extremely low and the sperm count is extremely low, we find out means to improve it and then counsel them to undergo IVF, which is a very easy option.
All right. Thank you so much for explaining in such detail, Doctor. Could you now enlighten us, as you mentioned about the diet, the importance of diet when it comes to fertility? Can you, suggest certain food that should be included in the diet which can boost fertility?
I am as a person is more for diet in case of fertility. I personally believe when some individual improves their lifestyle, which means they have a very disciplined routine, sleep as well as food habits, then their fertility potency increases by bounds. I've seen in so many patients, I've just counseled them and then they go back, they get back to a good routine and come back with easily getting conceived. So it's just like a miracle nowadays. So I will tell you, food plays an important role nowadays. Okay, so what exactly should we take? One thing I'm very concerned about is timing of intake of your food. I will always advise an early breakfast and avoiding late night dinners. Just wind up your dinner by 6-7 o'clock in the night. It's always good for your body to regenerate itself. At least have a 12-hour interval when your next meal comes. So when you wind up at 7 p.m., just have liquids after that, and then you can have your next meal at 7 or 8 a.m. in the morning. So your body gets time to metabolize as well as regenerate. Regarding specific food, I'm always for a good vegetarian food. So I will tell you, take lot of fresh vegetables. Any vegetable which is green, yellow or orange in color is very, very good actually. So take a lot of vegetables in your diet and take a lot of proteins. Proteins as such which will include egg white, nuts and then sprouts. They are very important components. And some people who go for gym, they take some kind of additives. Just I will ask them to avoid all those things. Just have some balanced diet, especially some which is rich in proteins and vegetables. Some specific foods are, there is a content called as the badam. So when there's one part of badam, when you put it in water, that will come swelling, it will swell up as such a good, some kind of agar-like thing. And when you take it, it is very good actually. Second thing is some kind of red bananas, carrot, avocado fruit, and all those things are really good for the males. But as such, I will generally tell you good timely food routine, avoiding a lot of alcohol, avoiding smoking, having a good physical activity for at least 1 hour per day. All these will contribute together to increase the sperm concentrations.
Well, thank you so much. I think we all acknowledge that diet part, but kind of, ignore or avoid that part of our life.
We are not able to follow it.
Well, thank you so much for sharing such valuable insight. It's been so helpful for the audience, I think, seeking such information. Thank you for your time.
Thank you so much for having me. Thank you.